Hello and welcome to our presentation. Today we'll be talking about 4D ultrasound, the technology and its clinical applications. This presentation is brought to you by Group 8 with Ankit Chawla, Fatima Ismati, Stephanie Soy, and Stephanie Villabarut. As an overview of the 4D ultrasound presentation, we will talk about what is ultrasound, the importance, the pros, cons, and conclusion.
Ultrasound scans are a medical imaging procedure that utilize ultrasonic vibrations to observe internal soft tissue structures. Piezoelectric crystals in the ultrasound transducer converts electrical signals to sound waves and vice versa. This transducer sends high-frequency sound waves through the body and collects the echoes that bounce back. By measuring the speed of each echo's return, the scanner calculates the distance from the transducer to the tissue. These distances are then used to generate two-dimensional images of the tissues and organs. 3D ultrasounds use multiple emitters placed in different angles surrounding the target to produce multiple images, which are then interpreted through algorithms to create a 3D image. Similarly, 4D ultrasounds use multiple emitters to create a 3D image, except the image is then rendered repeatedly, resulting in a time-lapse of the images.
4D ultrasound is the eyes for helping doctors get a closer look in order to make an accurate diagnosis for patients for further screening and treatment. The importance of 4D ultrasound and its clinical uses include the examining of organs and connective tissues in order to detect for any abnormalities for continual monitoring and to see if there are any further testings required. 4D ultrasound can monitor the velocity of blood flow in the heart. This is mainly to help with distinguishing a change in direction of flow that is normally caused by turbulence from having plug blockages in the artery. This method is called color Doppler, which codes the speed of flow in various colors. For example, in the image to the right, you can see that the red areas indicates blood moving away from the transducer, whereas the blue areas indicates blood moving towards the transducer. It also helps with treatments. For instance, it shows the correct site for biopsy by allowing accurate placements of needle injections in order to locate the best place to take a tissue sample from the body. Occasionally, 4D ultrasounds can be used for the early detection of cerebral palsy in premature babies, favorably due to being less invasive than other procedures. Since pregnancy is full of the unknowns, it takes the guesswork out of this area by monitoring health progress and screening for any complications. 4D ultrasounds are only performed when medically necessary and is currently the more sought out modality for younger patients and in pregnant women, owing to the absence of tissue damaging radiation rays that are normally found with such modalities as MRI and CT imaging. It is completely safe and painless not only due to having no radiation exposure, but it does not require anesthesia or sedation in most cases.
4D imaging has numerous benefits that have contributed significantly to society. 4D ultrasound is a painless and non-invasive procedure that enables doctors to obtain high quality and detailed images of moving fetuses, know the baby's gender and development, more accurately identify any anomalies, especially of the heart, limbs, face, skeleton, and neural tube, determine fetal brain impairment by assessing behavioral patterns, decrease psychiatric and surgical morbidity during the first trimester of pregnancy. This is by allowing the option of any early versus late termination of pregnancy, which minimizes the risk of miscarriage from an invasive procedure later on in a pregnancy. Detect chromosomal defects, for example Down syndrome, by measuring the amount of fluid behind the fetus's neck. 4D ultrasound poses some disadvantages that expecting parents have to take into consideration, such as cost. It's relatively a costly procedure as it utilizes expensive machinery, requires professionals to perform the procedure, so longer training is needed to operate the machinery. Low quality images. fetal movements will affect all planes of viewing. Visual obstruction. The shadows may hinder the view if the fetal spine isn't at the bottom of the scanned field. Ethical issues such as sex-specific abortion in developing countries such as India and China.
Although there are many beneficial clinical applications of 4D ultrasound, the strength in delivering high-quality images can still remain relatively low and would not be able to support current issues like visual obstruction, artifacts from sound wave, and uncontrollable internal body movements. Nonetheless, it is an exceptional modality and could otherwise be enhanced with modern tools and knowledge, potentially reducing cost and professional training in the future.